Hello and welcome to this edition of Time to Social Media's Tip of the Week. My name is Christine Barrett. I'm a social media and marketing strategist for healthcare and wellness professionals, and I'm also a registered nurse. I wanted to talk about the 2024 health and wellness trends that you need to watch for coming up in this upcoming year. And a lot of it stated is going to be pretty obvious, but there are so many changes going on in the digital landscape that we really need to pay attention to how this is going to impact our businesses in health and wellness, and also how it's going to impact our relationship that we have with our patients and our clients, and how we are going to maintain compliance with regulatory requirements through state and federal guidelines, HIPAA, and things like that as well. So here are a few high points that have been going on even since, since 2020, but are coming to the forefront again about the staff shortages when it comes to hospitals, doctors' offices, whatever it might be. And a lot of it is that it actually is not a shortage of people who are licensed. Like, say, for instance, I'm a registered nurse, but I'm not working right now in that particular field. I'm working, of course, as a social media marketing strategist. I do still maintain my nursing license, but I'm not working in the field. And I think that, I know that in the state of Florida, and plus a lot of other states, you will see that there are plenty of people who have their license but may no longer be practicing in that capacity. So it's not that there's a shortage, it's a shortage of people who are actually working in the field. And that brings more challenges to anybody in health and wellness at all, because you want to improve your operational and cost effectiveness when you're talking about that. And then also with the increase in your expenses, with anything that you need to provide, any supplies that you have to use within your office and in your field. And also if you are if you are hiring some people to help you within the office, then a lot of those wages and salaries have higher requirements to them. There's a lot of people now who are very accustomed, especially the upcoming generations with what happened with 2020, is working from home or remotely. Is that something that is going to be an option within your practice? So the digitalization that they're using now is going to let you have a lot more access, to that healthcare data, which is now going to you're going to start to see it stored differently and you be able to access it differently. Say, for instance, if somebody goes into an office or is having some type of medical emergency, instead of just having to wing it to figure out what's going on with them, you'll be able to access those records very quickly online to know through the digital landscape, to know exactly what's going on with the history of the person that you're trying to treat, to make those health decisions that we make as professionals more accurate to help that person. So also with that too is AI. There's no way I can't not mention AI. AI is huge, and it is going to affect every aspect of every job everywhere. Whether you choose to embrace it or not, it's here, it's moving forward. I would encourage you to stay with the times and stay educated on what is available and what can help facilitate a lot of the administrative responsibilities. One, because 25% of your time as a medical provider is spent on administrative duties, whether that's charting, coding, just writing down what you need to write down to keep up with the patient. And you think about that, that's a fourth of your time. That's a lot of your time that you're dedicating to that, when maybe there's an AI powered tool that might be able to assist you with that. So also the other big shift is all to community-based wellness initiatives. And we know all the things that are virtual that are happening now. Some more like hobby-based movement. You think about hiking or gardening or things that you can do just to get some daily movement in, and encouraging that. There's those meditation apps. I happen to love the Calm app to help you, get like your mental wellness and stress reduction and mindfulness. Just using your those apps to have a few minutes throughout the day, just even for deep breathing. Those apps are very effective and can be very helpful for people within the industry, and for your patient and for us within the industry as well. Probiotics and gut health. I mean, talking about your gut microbiome is a big thing now, and having patients educated in their dietary choices and pre and probiotics, and how, your gut is your health. If you have a healthy gut, you're pretty healthy. So gut health, health wearables, all the things you wear on your watches, and those things that you can have that can monitor your sleep and your exercise and your heart rate and everything else too. Those also working into the healthcare and wellness landscape, as well as smart mattresses. You got sleep tracking apps. Those things as well can see how well you are resting, and maybe some habits that need to be formed or changed in order to get a more restful sleep. Personalized nutrition. There's a long list of stuff. Individualized diet plans, genetic and lifestyle factors, and how nutrition impacts your overall health, not just your physical, but your mental health as well. Virtual reality, all that for fitness regimens and working out at home. All the different, the Peloton and the VR Meta things that you can do. It's limitless, or it's going to continue to grow. It is limitless. Things about mental health awareness, resources and strategies for mental well-being, including those the roles of social media and online communities and how that can affect your mental health. Also, the movement towards sustainability and taking care of our planet. They make eco-friendly fitness gear, how to have a sustainable diet and commit to both the environment and your personal health. And then you've got your community-based, just group wellness activities and communities now, and the power of a community-driven wellness initiative. So my question to you is, as we're moving forward in this and you're talking to your patients, your clients, whatever it might be, whatever you provide them, and that could be, you can be an esthetician, you can be a chiropractor, you can be a physician's assistant, nurse practitioner, you can be helping patients with insurance coverage. All these things are all integrated together. And one thing that always comes to my attention is that how are we making sure that the information and the things that are available that our patients or our clients are going to follow through with that. Accountability is a big thing now. And we see that with this big surge of health and life coaches and business coaches and all these other things, in order to have somebody and an accountability partner, somebody that you can maintain some confidence in. There's group coaching and things like that. How are those things incorporating maybe into your own practice, or your own wellness practice, or your healthcare practice, to ensure that your patients are getting the very best outcomes that they can get, and they are compliant with treatment? It's so easy to say, lose 10 pounds. You need to lose 10 pounds. Well, how are you going to do that? You have maybe somebody who's juggling, trying to take care of young children and has a full-time job and their sports, and maybe they're a single mom and they're trying to integrate all this stuff. And convenience foods are the way to go. A drive-through to get something to eat, and all those things impacting their overall health. How do you educate them and get them to change their habits in order to have a better lifestyle? Let me know in the comments what you plan on doing for your health and wellness business to make sure that your patients have the best outcome, and which one of these strategies or these things in the digital landscape can help you. If you found this helpful, please let me know in the comments below. And if you have any questions related to any of this, I am happy to help you answer that. Also with social media marketing and help guiding these patients and potential clients to your services to better have them health, better have them take care of themselves. You don't want to be the best kept secret. I know you've had patients said to you before, I wish I'd found you sooner. I wish I had known about this sooner. I wish I had started this sooner. So let's not be the best kept secret. If you want to get your patients and potential new patients and clients in the door, I am happy to help you with that. So reach out in a personal DM, make a comment below, or feel free to contact me directly at Christine@time2socialmedia.com. My name is Christine Barrett. I'm a registered nurse, a social media and marketing strategist for healthcare and wellness professionals. Until next time, have a great week and go out and spread some love. Bye.